Antifungal drugs are used for the treatment of fungal diseases, and fungi are the member of the Eukarya domain, so it is a kingdom fungi. And eukaryotic uh, organisms, and the fungi is divided to two types of the fungi. One is the yeast and second is the mold. So yeast you can use to prepare a bread. So this is actually a wheat that is mixed with the water and yeast. And molds you can find in the cheese, French cheese. This, for example, is a blue or blue mold with the cheese. And the yeast are the most important, medically important bacteria. Among the yeast is Candida, and Candida are different species are known. Candida is common in Candida is also a normal microflora of the vagina, but sometimes can be seen in the mouth as a thrush. And the second is Pneumocystis jirovecii, is seen usually in immunocompromised patients and HIV patients. Then the molds include Aspergillus species and mucormycosis, and this mucormycosis lead to the mucor, can be mucor, rhizophus, and abscidia. So these are mostly the dermal diseases, that most usually lead to the dermatological diseases, whereas yeast are usually some organ disease. And the mechanism of action of different drugs are usually based on the specific for the fungi cells reactions. And most of them are the ergosterol metabolism drugs, like the most commonly used azoles like clotrimazole, fluconazole. Fluconazole is most commonly used during the vaginal candidosis, and also itraconazole, ketoconazole, miconazole, and voriconazole. So this is azole group. Azoles is a chemical structure, and azoles will inhibit demethylase, are used to synthesize ergosterol. So ergosterol is a primary replacement for the prostaglandins in the cell wall. So human cell wall will synthesize prostaglandins from arachidonic acid. Ergosterol is a replacement for the arachidonic acid in the fungal cells. Then second group is allyl amines. This is terbinafine and naftifine, and also butanafine. These are squalene epoxidase inhibitors. They inhibit the synthesis of lanosterol from the squalenes. So this is the previous step of the ergosterol synthesis. So these drugs decrease the ergosterol synthesis and then inhibit the cell wall structure. Then the second group is amphotericin B and nystatin, commonly used for the treatment of the thrush and vaginal candidosis as well. They inhibit uh, the ion channels, and entrance of the ions is uh, uh, will increase, and that lead to the hyperosmotic cell of the uh, fungi. Then echinocandins are the uh, glucan synthetase inhibitors, and usually used for the Aspergillus candida species families. And these drugs include micafungin and caspofungin and imidubafungin. Then there are also grisofulvin that inhibits the mitotic spindle, and flucitazine that inhibits the DNA synthesis in the uh, that inhibiting the 5-fluorouracil uh, that prevents the DNA synthesis. So these drugs are used for the treatment of fungal diseases, and fungal diseases are divided to systemic and cutaneous. So systemic diseases are treated with the amphotericin B, flucitazine, diazole types like fluconazole, for example, and echinocandins. Cutaneous are mostly dermatological diseases that drugs used for this group of the diseases is squalene epoxidase inhibitors, including terbinafine and glycofulvin, the nystatin and imidazoles, clotrimazole and ketoconazole, and other drugs like cyclopirox and tolnaftate. So these are the two types of the diseases, and the different groups are used for systemic and cutaneous. So amphotericin B is one of the first ergosterol metabolism inhibitors, uh, and will make a pore that uh, can go through this ion channel, and this leads to the potassium and calcium loss and death of the cell. Then amphotericin B is injectable, and can be also applied topically, and adverse effects includes fever, chills, kidney failure, hypertension, and anemia. Fluconazole is most commonly used drug. Is ergosterol metabolism inhibitor, so it inhibits the synthesis of the ergosterol, and that decreases the permeability. Increases the permeability of the membrane, that leads to the cell death. And the derivative voriconazole is actually inhibiting the enzymes of the liver. That is why it should be not combined with the warfarin and phenytoin and other drugs that are metabolized in the liver. Then squalene epoxidase inhibitors are used for the treatment uh, uh, and lead to the ergosterol metabolism as well, but also will produce a toxic product that also will lead to the antifungal effect. And terbinafine is, and also naphthidine and butanafine are available orally. So then grisofulvin will disrupt the mitotic spindle, and grisofulvin usually used in the severe cases, mostly for the uh, uh, cutaneous infections, and is actually uh, adverse effects are severe and can lead to the serious side effects, including the uh, blood blood synthesis, like the thrombocytopenosis, and uh, also the uh, anemia. So that is why it is not used. It should be used with the caution. So I think that is all for today, and thank you for your attention. And do you have any questions?